Welcome to the Roseland East 115th Street Health Hub. Good morning. Before we go in for the tour of the clinic, I'd like to introduce you to this really cool harm reduction machine that sits in the vestibule right off of the street on 115th for the Roseland Health Hub. It has lots of things that will provide good protection for folks, whether it's Narcan, xylazine, other kinds of things that are really helpful in terms of reducing harm for our community. If you want to learn a little bit more about the machine, go to Chicago.gov/vending machines, all one word. So you guys ready for a pretty cool clinic experience? Our clinic is professional, it's whimsical, and it's very welcoming. So I say all of that to let you know that even though sometimes you can feel a little vulnerable, this is actually a place where you can get your educational needs met. And you can also get a lot of things done in terms of your optimal health and wellness for sexual health. All right, so we're gonna start our tour. First stop is actually the laboratory space, but not the first stop for patients. They actually have their specimens end up there. When you enter our unit, we have our triage room. We have our reception space. And do you feel like doing a little disco when you walk into our waiting area? I do. We've got a copier room, a room where we draw our blood, or our phlebotomy room. We have 2 rooms for our providers. I sit back here in the nursing space, and then my vaccine room is right next door. As a kid that grew up in the West Garfield community, we're accustomed to spaces that are under-resourced, but oftentimes overburdened with infections, and for us, specifically syphilis and HIV. So for me, it is paramount that I, using all of the experience that I've had as an HIV primary care nurse, try and engage people, educate them, and hopefully get them to consider, through shared decision-making, an HIV prescription for Truvada. Also, if we can actually get them to consider doxycycline for post-exposure prophylaxis, we can actually see a reduction in chlamydia, syphilis, and to a lesser degree gonorrhea. In the 80s, I experienced firsthand a lot of loss. I had very dear persons to me lose their fight with HIV/AIDS because at that time we didn't have a lot of great medications for them. When I became a nurse, I actually became a nurse because I made a promise to someone who wanted to be a nurse, but he did not survive. And so I became a nurse for the both of us. In 2012, I actually began HIV primary care and happily was one of the first couple of nurses that started HIV prevention work. So we had the first pilot here at the Department of Public Health, and now there's a new iteration of it. And so I'm really excited about what we can offer in the way of preventing HIV infection. Even that said, if people are newly diagnosed, and we've had probably 3 or 4 new infections in the last 3 months or so, it makes me feel heartened that I can make sure that they get connected to care and that we can make sure they have a really good optimal level of health and wellness, no matter what their diagnosis is. I always say all results are good results, even the ones that we don't really want to hear. That's why I'm here.